Go.
Okay, so hi, my name is Mark, M-A-R-K, Kendrick, K-E-N-D-R-I-C-K, Frianeza, F-R-I-A-N-E-Z-A. As for today, I'm gonna do my head-to-toe assessment video. Before I start it, I'm just gonna introduce you to my sister, Raven Ashley. She's gonna be my patient for today, and also my mom, Raquel Frianeza, as my videographer. Now I'm gonna show you guys the environment that I'm gonna be working on. Okay, so now I'm gonna go ahead and start my head-to-toe assessment. So before I enter, I'm gonna go ahead and do my hand washing. And I'm gonna also, and now I'm gonna go ahead and sanitize the equipment that I'm gonna be using. So now I'm ready to go inside to the patient's room. Hi, my name is Mark. I'm gonna be your student nurse for today. We're gonna be conducting head-to-toe assessment. Is that okay for you?
Yes.
Before we started, do you need to go to the washroom or to empty your urinary bladder?
No.
No? Okay, so I'm gonna go and provide the patient's privacy. Okay. So can you please tell me your name
Raven Frianeza,
and your date of birth?
February 24, 2005.
Okay. Are you aware of where you are right now?
I'm at the hospital.
Okay, thank you. Now, the patient appears to be alert and oriented. As I can see, her sexual development is appropriate for her age. Her color is appropriate for her genetic background. The patient is well groomed. The patient's height and weight is appropriate for her age. Her posture is straight. The patient appears to be relaxed as well for her behavior. Her voice is clear, and she answered all my questions while doing eye contact. And the patient as well is not showing any distress or any signs of shortness of breath, or the patient is also her breathing is normal. Okay, so now I'm gonna go ahead and assess her head. So as I can see, her head has no patchiness. Her hair is well distributed, um, and also there's no manifestation. Now I'm gonna go ahead and palpate her head. Did you feel any pain?
No.
No? Okay, so there's no pain or no tenderness. Her head is normocephalic. There's no lesions, bruising, or any bulging. So now I'm gonna go ahead and test her face. As I can see, there's no bulging, there's no lesions, no crackling, or no bruising as well, no deformities for the face. And now I'm gonna go ahead and palpate her face. Did you feel any pain?
No.
No? Okay, so she doesn't feel, for the face, the patient doesn't feel any pain or tenderness. So now I'm gonna go ahead and check her eyes. I mean, her cranial nerve facial. Okay, so can you please smile for me? Frown. Uh, Close your eyes. Raise your eyebrows. Show me your teeth, and also puff your cheek. Okay, so the cranial nerve facial is intact. Now I'm gonna go ahead and check her eyes. As I can see, her eyebrows is well distributed. Her eyelid is and her eyelid and eyelashes is symmetrical on both sides. Um, Her sclera is pinkish and intact. The positioning and the shape of the eye is symmetrical on both sides. I don't see any sign of lid lag, um, or any um, ptosis or lazy eyes. Um, there's no any discharge as well, and no lesions. Okay, so now I'm gonna go ahead and test her eyes for perla. Okay, so perla means pupil equal round reacting to light and accommodation. Okay, so I want you to look in the to my face. Okay, so the patient's pupil is round. It is reacting to light, and also the size of the pupil. Her pupil is 3 millimeters. Now I'm gonna go ahead and check her eyes for accommodation. Okay, so I want you to look into my pen light and follow it using your eye. Okay.
Okay.
Okay, side, side, front. Okay, so her eyes is accommodating. Okay, so now I'm gonna go ahead and check her sinus nose now. As I can see, her nose is on midline. No discharge, no lesions, and no edema as well. Okay, so I'm gonna test your nose for nose patency. Okay, I want you to cover one of your nose and inhale for me, please. And I want you to cover up on the other side as well and breathe. Okay, so her nose is as her nose is patent and clear. Okay, so now I'm gonna go ahead and palpate her sinuses. First, I'm gonna go ahead and palpate her maxilla sinuses. Did you feel any pain?
No.
No? Okay, so now I'm gonna go ahead and palpate her frontal sinuses. Did you feel any pain?
No.
No? Okay, so the patient verbalized that she doesn't feel any pain or tenderness on both sinuses. So now I'm gonna go ahead and check her ears. So as I can see, both of her ears is symmetrical when it comes to shape and positioning and size as well. I don't see any discharge or any lesions or any deformities, and no lesions as well. And the color is matches the body. Same goes on the other side. It's no discoloration, no discharge, no edema or no bleeding as well. So now I'm gonna palpate her tragus and her auricle. Did you feel any pain?
No.
No? How about on the other side? Did you feel any pain?
No.
Okay, so there's no pain and no tenderness. I'm gonna do whisper test right now. Okay, so I want you to cover one of your ear, and I'm gonna whisper on the other side, and I want you to repeat after me. Okay?
Alright.
Basketball,
Basketball.
volleyball,
Volleyball.
and then the other side, orange,
Orange.
pineapple,
Pineapple.
apple.
Apple.
Okay, so the patient verbalized it clearly and correctly all the words that I said. So now I'm gonna go ahead and check her mouth. Okay, so as I can see on her lips is hydrated, no cracking, no bleeding, and no lesions as well. Can you please open your mouth so that I can check your inner part of your mouth? So the gums is pinkish and no bleeding. Her teeth is intact, no looseness, and no bleeding as well. Her gums is pinkish and no bleeding. Can you please stick your tongue out for me? Okay, thank you. Okay, so her her tongue is no bleeding, no cracking, well hydrated as well, and pinkish as well. Can you please lift your tongue out for me? Okay, even the bottom or the base of the tongue is pinkish, no bleeding as well, and no lesions. Okay, so now I'm gonna go ahead and check her hard and soft platelet. So her hard and soft platelet is intact and pinkish as well. Now I'm gonna go ahead and check her glossopharyngeal. I want you to stick your tongue out and say ah. Okay, so her uvula and hard platelet and soft platelet rises, so it means that the glossopharyngeal is intact. Now I'm gonna go ahead and check her cranial nerve vagus. Can you stack your tongue out for me, please? Okay, so the patient shows a positive gag reflex, which means the cranial nerve vagus is intact. Okay, so now I'm gonna go ahead and check her hypoglossal. I want you to stick your tongue out for me, please, and move it side to side and up and down. I want you to repeat after me. Light, tight, dynamite.
Light, tight, dynamite.
Okay, so the patient appears that she can verbalize the words correctly. So it means that her cranial nerve, hypoglossal is intact. So now I'm gonna go ahead and check her neck. Her neck is no masses, no bruising, no bruising, no lesions, and no bulging as well. Her trachea is on midline. Her carotid artery is the rate and the rate of the carotid artery is normal and regular. Same goes with the other side. Her carotid artery is regular and normal. Now I'm gonna go ahead and test her shoulder. Okay, so I want you to shrug for me, okay?
Okay.
So this is to test your resistance against range of motion, okay? Okay. I want you to push my hand using your face, okay? And how about the other side? Okay. So the resistance against range of motion of her both her spinal nerves is intact. So now I'm gonna go ahead and check her upper limbs. Okay. So as I can see, the hair distribution is equal. The color matches her body. No lesions, no masses, no no bulging, no bruising as well. Same goes in the other side as well. Okay, so now I'm gonna go and check your pulse. Okay, so her pulse is 32 32 32 beats in 30 seconds. So it means it's 64 beats per minute. Now I'm gonna go ahead and check her capillary refills. Can you please open your fingers like this? Okay, so her capillary refills on both sides is it goes back quickly. Now I'm gonna go ahead and check her range of motion. Can you do flexion for me? Extension, ulnar deviation, and ulnar deviation downwards. I want you to do flexion using your elbow, and flexion, extension, and then pronation, supination, and I want you to do abduction and adduction. I want you to do as well internal circulation and external circulation. Okay, so the patient appears that she can do a range of motion properly without any difficulties. Okay, so now I'm gonna go ahead and check her lower limbs. Okay, so as I can see, the temperature is warm, hair distribution is equal or well distributed, no bruising, no lesions, no masses, no bulging as well. Okay, so now I'm gonna go ahead and check her capillary refills in her toes. Okay, so her capillary refills on both toes goes back quickly. Now I'm gonna go ahead and check her dorsalis pedis. To check her dorsalis pedis, you have to put your your fingers on the toes and go up a little bit, and you're gonna feel the dorsalis pedis right there. So the rate and the strongness of the dorsalis pedis is normal and regular. Okay, so same goes on the other side, toes and up a little bit, and there you can feel the rate and the strongness of the dorsalis pedis. So it's normal and regular. Now I'm gonna go ahead and check her posterior tibialis. Okay. So to locate it, you have to look for the mesocealus, and it's actually the posterior of the mesocealus is right. You can find your posterior tibialis. So the rate and the short strongness is normal and regular, and same goes to on the other side as well. Look for the mesocealus, and you can find the posterior tibialis right there. It's the rate and the strongness of the pulse is strong and regular and normal. Now I'm gonna go ahead and check her range of motion. Um, can you please do flexion for me? Extension. Okay, so the patient can do range of motion properly without any difficulties. Now I'm gonna go ahead and check her thorax. Okay, so to check the thorax, you need to have to hear the sound. You need to locate the valve. Okay, so go on left to right, and then you're gonna find on the right side is the aortic valve, and then that's on second intercostal, and then you're gonna go on the left side. You're gonna find the pulmonic valve. Go in the third intercostal. You're gonna find the Erb's point, and then on the fourth, you're gonna find the fourth intercostal. You're gonna find pulmonary valves, and on the fifth one, on the mid clavicular line, you're gonna find the mitral valve, and there you can hear the S1 and S2 as well. And now I'm gonna change it to the second my stethoscope to the small ones to hear any abnormalities or any deformity, any abnormal sounds or extra heartbeats. Okay, so there's no any heartbeats or any normal extra heartbeats as well. Okay, so now I'm gonna go ahead and check her abdomen. Can you please lay down for me, please? Okay. So as I can see, her abdomen is flat. No, no bulging, no lesions, no bleeding, no no discolorations, and no deformities as well. I'm gonna palpate it. Do you feel any pain?
No.
No? Okay, so there's no pain. Now I'm gonna here for her vowel sounds. Okay, so I'm gonna start in the lower part and goes to upper part. Okay, so as I can hear, okay, so her vowel sounds is uh is her I hear a positive gag reflex on the lower quadrant, which is actually really good. And on the left side, lower quadrant, I heard the loudest because of the sigmoid colon is located. Okay, so now I'm gonna go ahead and check her abdomen. Do you feel any pain?
No.
No? Okay, so now I'm gonna go and hear her abdomen. Okay, so her abdomen is, the patient verbalized that there's no any pain or any tenderness, no masses as well, and the patient is cooperating in all of the assessment. So that's it.